Hello, everyone. Welcome. Welcome to Ask Dr. Bob. This is where you get to ask questions of me, Bob Gabbay, the Chief Scientific and Medical Officer for the American Diabetes Association. And this is already the 7th episode, so thank you so much for joining. If you have not, if this is your first time, welcome and spread the word. So this is Healthy Vision Month. So we're going to focus in on vision and eye health. And the American Diabetes Association has a big initiative around this, and you'll learn more about that. But most importantly, you'll learn about eye health and what the connection is with diabetes. So, without further ado, I'm going to start with the questions. And so the first question is, what is diabetic retinopathy? Uh, so retinopathy is opathy, which is pathology or uh, uh, illness, uh, disease associated with the retina. And so, what is the retina? The retina is the screen of your eye. So, think of your eye. You have the eyeball, and you've got the sort of hole in the middle where the opening in the middle that the pupil opens up and down, and it lets light in, and it projects everything on a screen in the back of your eye. That screen is called the retina, and what gets projected on that screen is then what your brain interprets as everything that you see. So, what is diabetic retinopathy? It's pathology, it's disease of the retina, of that screen. And it's a damage of that screen that happens in diabetes. And so, what the next question is, how is eye health related to diabetes? Like, why are we even talking about the eye in Ask Dr. Bob today? Well, so it turns out that diabetes is one of the leading causes of blindness, and the it the sobering part of this, and in some ways the sad part, is that most people that lose their eyesight from diabetes, it, it's preventable. We can prevent it, and we'll talk more about that. And there are a number of questions here that get to that. So, the connection between eye health and diabetes, um, really, diabetes is the leading cause of eye disease and blindness in the U.S. So, the next question is, and again, thank you all for sending questions. Feel free to ask more through the chat box. I'm going to go through the ones I already have for starts. So, next question. What are some of the early signs of diabetic retinopathy, of eye disease of the eye? What are the early signs? Well, what a person with diabetes might notice is sometimes more flashes of light or shadows or blurry vision. And the question is, what's going on? What are these early signs? What's really happening here? And so let me try to walk you through. So we talked about the retina being the screen of the eye where all the images are projected onto that screen. And that screen has a lot of blood vessels to give a good amount of nutrients and blood flow to the screen, to the retina. Well, what happens in diabetes, or can happen if blood sugars are not well controlled, for example, is those blood vessels start to leak. And as they leak, it damages that screen. And as a result, it can affect your vision. And when that leakiness or edema happens in the part of the eye that is responsible for your sharpest vision, the macula, um, we have something called macular edema. And macular edema, that's serious. If you have that, you need treatment right away, and it left untreated can lead to visual loss. The good news is we can treat it. So that brings up the next question. So, how often should I get an eye exam? So, what I just described about that, those vessels leaking in the screen of the eye, the edema that can happen in different places, in particular in that important part of the screen of the retina called the macula. Most people wouldn't even know that's happening until it starts to significantly affect vision. And so that's why it's important to see your eye care professional and get an eye exam, because you wouldn't be able to know, but you may be at risk for losing your eyesight. So the question was, how often should I get an eye exam? And the simple answer is once a year. For most people, once a year is the right amount. Some people may need it more often if they have more serious disease. And again, your eye care professional will let you know that you should be going more often. One thing we do know is that because of the pandemic, a lot of us have pushed off care. And as many as 1 in 4 people with diabetes have delayed their care because of the pandemic. It's time to go back. It's time to plug back in to your care. And one of those things should be eye care and getting an eye exam. And one little point I'll say about that eye exam: not all eye exams are the same. What you want is a dilated eye exam. What does that mean? They put drops in the eye and it opens up the pupil. It's painless. You don't feel anything, but they can look in the eye more effectively and be able to see that screen in the back better and be able to see if you have leaky vessels or any kinds of problems like that. Sometimes those vessels can even bleed, and they can see all of that in an eye exam. So again, once a year eye exam. Um, and what is an eye? So the next question, which we started to answer, is what does an annual eye exam show, and why is it important? Well, it's important because the eye care professional can identify things that you wouldn't know you had, that if left untreated could lead to visual loss. And the good news is they can treat it. We have excellent treatments now for diabetic retinopathy. Really a big advance in treatment from what used to exist some years ago. And that's why they need to check you out. And if you need those treatments, then give you those treatments. You get those treatments. In general, you don't lose your vision. And again, for all of us, you know, one of the biggest life-changing things that could happen would be losing our vision. And again, the good news is you don't have to get an annual eye exam, and we'll talk about other ways that you can keep your eyes healthy. So, next question, and again, thanks for sending these. How early should I schedule an eye exam for my child living with diabetes? Good one. So, children, of course, children can develop diabetes, of course. And, um, you know, this is where it's really important to ask your pediatric diabetes specialist what they think. But generally, this is going to be starting at age 10, is where most of the recommendations are. It typically, for people with type 1 diabetes, remember I'm saying for type 1, it typically takes 5 years to develop significant retinopathy. Um, in type 2, because many people may have type 2 for a number of years before they even realize they have diabetes, they need an eye exam as soon as they're diagnosed, because they could have had diabetes for 5 years already. So, again, get your annual eye exam, please. Next question. Is there anything I can do to prevent diabetic retinopathy? Absolutely. There's a lot that you can do. We already talked about getting the yearly eye exam. The other, so that you can catch things early before they impact your vision. The other big one is blood glucose control. That makes a big difference on the eye. And so, what we're talking about is managing your blood glucose. and thinking about what your A1C is. If you don't know what your A1C is, that's the number you should know. That number gives you a sense of your average blood sugar over 3 months. It's a blood test that your healthcare provider can do. For every 1 point drop in that A1C, you drop the risk of eye disease by 1/3. So a small change in A1C, big advantage to your eyes. So if you went from an A1C of 9 to 8, that is dropping your risk by 1/3. So watching your blood glucoses, and the other big one is blood pressure. For people that have high blood pressure, that worsens eye disease. So keep track of your blood pressure, keep track of your glucoses, and get your yearly eye exam. And if you're able to do those things, you can largely prevent a lot of the problems that are connected with diabetes and eye disease. So the next question is, can diabetic retinopathy be reversed? They say, if not, what can be done to minimize the damage moving forward? Well, this is where we've made some really big advances in understanding how to prevent progression of eye disease. So let's get back to why what is eye disease and diabetes, and what is retinopathy. It's the screen of the eye. The blood vessels on that screen get leaky, and that causes all sorts of problems. Well, there are now treatments that can stop the leakiness and the impact of that leakiness of the blood vessels, and they're called anti-VEGF therapies. There's several of them, and this is something that an ophthalmologist can treat you with and help you. An important thing to remember is the different kinds of eye professionals. There are doctors of optometry. There are lots of them, and there's probably one near you, and they can do that dilated eye exam. And when it comes, and as can an ophthalmologist, um, the ophthalmologist and the retinal specialist, which is a specialty within ophthalmology, these are medical doctors, uh, and they can do the treatment, this anti-VEGF therapy, or sometimes using laser treatments to protect the eye. So they can prevent further damage of the eye if you already have diabetic retinopathy. So you go to the eye doctor, they say you've got retinopathy, there's stuff that can be done. Um, let's see if we have some more questions here. I've gotten through many of our initial questions. Um, so, what eye drops are recommended for someone who has type 1 diabetes? Who should I talk to about it? Well, I would say in general, you may not need any specific eye drops unless you have some eye problems. And that's where seeing your eye care professional, them telling you, oh, you have an eye problem, and here are the drops that you should use. Some people have problems with dry eyes, and that not necessarily related to diabetes. And that's where there are a variety of different non-prescription moisturizing eye drops that can be helpful. But in general, people with diabetes don't necessarily need eye drops. It's only if they have a problem. And again, talk to your eye care professional. Um, and so I think we have maybe one more uh, question. Oh, no, a couple more. So my eye doctor told me my eyes are okay, but my diabetes doctor told me that I might have diabetic retinopathy. What should I do? Sounds like there's a little confusion and mixed messages. And, you know, sometimes that happens in healthcare because we'd all communicate as well as we should. And so um, I would say, and again, as you all know, I can't give specific medical advice to any individual because I'm not your doctor. Uh, but what I can tell you is that the eye doctor, if they did a dilated exam, they're the best people to be able to say whether you have damage to your eye and what that damage looks like. Um, your diabetes doctor can tell you that because perhaps your blood pressure is high or your A1C, your blood sugars are high, that you're at risk for developing retinopathy. And so they may both be right, but they're saying somewhat different things. So it's important to check with them. And please, everybody, never feel bad to ask your healthcare team a question when you're confused. Their job is to help you to take better care of yourself, but they can only do it if you ask them the right questions. So I think we have one last question here um, in honor of Healthy Vision Month. Um, and this is, where can I get some more resources about eye health? So the American Diabetes Association has a major initiative to really tackle this challenge of vision loss in people with diabetes, and it's called Focus Focus on Diabetes, and it's all about eye health. And so we have a great website with lots of information and resources that you can go to learn more, to hear some of the things we just talked about. And that website is eye health. That's EYE health, all one word. Eyehealth.diabetes.org. So eyehealth.diabetes.org. And you'll find a wealth of information to keep your eyes healthy, because we need our eyes, we need our vision. And so, in honor of Healthy Vision Month, please do what you can to take care of your eyes. I want to thank you for joining Ask Dr. Bob. Tell your friends about our program. We'll join you next time. Please send in questions that you have, and be well.